Hey everyone, welcome back to our channel. Today, we're uncovering some incredible insights from a doctor specializing in elderly health. You won't believe the vital signs he shared that could warn of cancer in seniors. Before we dive in, make sure to like and subscribe. You don't want to miss out on this crucial information, or you'll regret it. If you want to stay ahead of unexpected weight changes, persistent fatigue, or unexplained lumps, watch this video to the end. These are simple yet essential tips that not everyone knows, and they can help you detect early warning signs of cancer. Empower yourself with the knowledge to take charge of your health journey. So, let's uncover these essential health secrets together and hit that like button to keep up with more life-changing content. Let's get started. Number 1. Signs of unexpected weight changes. In the journey of life, the body often communicates in subtle ways when something isn't quite right. One of the more alarming signals it can send is through unexpected weight changes, either losing or gaining weight without any significant alterations in diet or exercise routines. This silent yet noticeable shift can be an early indication of serious health concerns, including cancer, especially in seniors. When weight drops without a deliberate effort, it might be due to the body using more energy than usual. This is often the case when certain types of cancer, such as those affecting the stomach, pancreas, or lungs, increase metabolism or decrease appetite. The body, in its bid to combat irregularities internally, might consume its resources more rapidly, leading to sudden weight loss that catches one off guard. Conversely, unexpected weight gain could sometimes signal fluid retention or other metabolic disruptions that require attention. Such fluctuations in weight warrant a conversation with a healthcare provider. These professionals can delve deeper into potential causes, exploring whether the change signals a benign condition or something more pressing. Through thorough examination and perhaps a few tests, they help determine the root cause of the weight change. It's essential for seniors who may already be dealing with multiple health issues to monitor their weight consistently. Keeping a close eye on their weight can empower them, offering insight into their health and prompting early intervention when necessary. A steady belt size isn't just about appearance, it's often a reflection of what's happening inside, unseen yet significant. Living with intent and awareness can help uncover hidden shifts like these before they blossom into more significant issues. As such, unexpected weight changes, although sometimes a normal aging process, deserve attention and a deeper look to ensure that what is happening beneath the surface can be managed proactively rather than reactively. Number 2. Persistent fatigue and its implications. Imagine waking up from a full night's sleep and still feeling exhausted, as though the weight of your body is heavier than usual, and simple daily activities require more energy than you possess. This ongoing, pervasive fatigue is not just a passing inconvenience for many seniors, it could be a sign that something more serious lies beneath the surface. Persistent fatigue, the kind that doesn't abate with rest, might indicate underlying health issues, including cancer. Fatigue associated with cancer is often more profound and more limiting than typical tiredness. It can stem from cancer's impact on the body's metabolic functions or as a result of treatments like chemotherapy, which tax the body's reserves. Certain cancers disrupt hormone balances or directly impair organs essential for energy production, leading to this chronic energy shortage. However, fatigue isn't limited solely to cancer. Other chronic conditions prevalent among seniors, like heart disease, diabetes, and thyroid imbalances, also lead to similar symptoms. The challenge lies in distinguishing fatigue's cause because it is such a common and non-specific symptom. For those experiencing persistent fatigue, it's crucial to engage healthcare professionals who can provide a thorough evaluation. They may recommend tests to assess blood counts, metabolic panels, and other indicators that can pinpoint the issue. The goal is to identify and treat the root cause early on, whether it be cancer-related or another chronic condition. Taking fatigue seriously is essential, particularly for seniors who may be prone to dismissing their symptoms as merely a part of aging. This awareness can prompt more timely interventions, which can significantly improve quality of life. While fatigue may seem like a vague symptom, its persistence is a signal to pause and investigate further because our bodies often know more than we realize. Number 3. Understanding persistent pain. Living with persistent pain can feel like carrying an invisible burden, a constant companion that shadows every move. For many seniors, this unending discomfort isn't merely a symptom of aging but a potential warning sign of something more sinister, such as cancer. Understanding and addressing persistent pain is crucial, especially when it lingers without clear explanation. Pain related to cancer can manifest in various ways, depending on where the cancer is located. It might be due to a tumor pressing on bones, nerves, or other organs, causing pain in those areas. For example, ongoing back pain with no visible injury could suggest a deeper issue, such as cancer affecting the spine or nearby structures. Sometimes, the pain may present itself as headaches, joint aches, or unexplained chest discomfort, which can indicate more significant health problems. While pain is a common experience shared by many, distinguishing between ordinary aches and those requiring medical attention is vital. Persistent pain that does not seem to subside should be discussed with a healthcare provider. These professionals can help differentiate between benign causes and more severe conditions through detailed medical histories and diagnostic testing. Addressing persistent pain offers more than just physical relief. It opens the door to uncovering underlying health conditions before they progress further. Typically, a physician might explore imaging or exploratory procedures aimed at identifying the cause of the pain, allowing for more targeted and effective treatments. For seniors, acknowledging persistent pain and taking action can be life-changing. It leads to a better quality of life, where discomfort no longer reigns over daily activities, and potential health threats are addressed before they worsen. Embracing the courage to seek answers is an empowering step toward maintaining health and well-being in the golden years. Number 4. Skin alterations and warning signs. The skin, our body's largest organ, often reflects internal health changes long before we are consciously aware of them. When the skin starts to change unexplainably, it might be signaling something more serious going on beneath the surface. For seniors, unexpected skin alterations can be particularly concerning and may serve as an early warning of cancer. Certain signs to watch for include new growths, changes in existing moles, and any sores that fail to heal. These changes can indicate skin cancer, such as melanoma, which requires prompt attention. Melanomas often present as asymmetrical spots with irregular borders and varying colors. As they progress, they may become larger or evolve in shape and texture. However, changes might also emerge in other forms, such as yellowing of the skin or eyes, jaundice, which could signal liver problems or pancreatic cancer. Skin rashes or redness might be symptomatic of underlying conditions such as leukemia or other types of cancers. Inflammation of the skin or visible blood vessels that are more pronounced without any clear cause could also point to medical concerns. Recognizing these changes requires diligent self-monitoring. Seniors should examine their skin regularly, noting any new or changing lesions or textures. It's essential to employ the ABCDE method, assessing asymmetry, border, color, diameter, and evolution of skin spots to evaluate potential threats accurately. Consulting healthcare providers about skin changes can offer peace of mind and facilitate early intervention when necessary. A dermatologist can run specific tests, including biopsies, to determine the nature of the changes. Early diagnosis not only halts possible progression but also significantly increases the chance of successful treatment. Incorporating skin checks into regular healthcare routines can help in catching these subtle yet significant shifts in time, paving the way for prompt care and better health outcomes. The skin story is but a chapter in the larger narrative of health. Listening to what it tells us can lead to longer, healthier lives. Number 5. The significance of persistent cough or hoarseness. A persistent cough or hoarseness can often be dismissed as a lingering cold or allergy symptom, but when these conditions last longer than expected, they may serve as crucial indicators of potential health issues, including cancer. For seniors, paying attention to these seemingly minor symptoms is vital, as they could herald more serious underlying problems. A cough that persists beyond a few weeks, especially one that worsens over time, requires further investigation. This is particularly true if the cough produces blood, or if there is an associated change in voice quality, such as persistent hoarseness. These symptoms could point to cancers in the respiratory tract, including lung cancer and laryngeal cancer, among others. Hoarseness or changes in the voice can arise when tumors affect the vocal cords directly or apply pressure to nerves controlling the voice. It's crucial not to ignore these voice changes if they persist for over 3 weeks without an apparent cause. Often, the sooner these conditions are examined, the better the outcome, should a serious condition be confirmed. Detecting these symptoms early involves being attuned to one's body and understanding when normal recuperative cycles have passed. Seniors should consider seeking medical advice if they notice a cough that lingers beyond the typical duration of a cold or if they experience hoarseness that does not improve. Healthcare providers can employ diagnostic tools such as chest X-rays and endoscopies to investigate the cause, providing vital information that guides treatment plans. Proactive health checks, especially in the respiratory domain, help uncover and address health issues long before they progress. By being vigilant about symptoms such as persistent coughing or hoarseness, individuals can take control of their health narrative, ensuring that they seek timely medical attention when it can make the most significant difference. Number 6. Difficulty swallowing. A red flag. Imagine sitting down to enjoy a meal, only to find that each bite brings discomfort or a struggle to swallow. Difficulty swallowing, medically known as dysphagia, can be a distressing experience that often signals a need for further investigation. For seniors, this symptom might not simply be a benign inconvenience, it could indicate serious underlying health issues, including cancer. The act of swallowing involves a complex interaction of muscles and nerves. When something disrupts this smooth coordination, such as a tumor pressing on the esophagus or throat, it can lead to discomfort and difficulty with swallowing. Cancers of the throat, esophagus, or even nearby structures can interfere with the passage of food, leading to this troubling symptom. In some cases, dysphagia may also be accompanied by other symptoms like weight loss, pain when swallowing, or the sensation of food being stuck in the chest. These additional signals can often guide healthcare providers to investigate the cause more thoroughly. For seniors experiencing difficulty swallowing, it's crucial to consult a healthcare provider promptly. Diagnosis might involve a range of tests, including barium swallow studies, endoscopies, or imaging to look for structural abnormalities. Identifying the source of dysphagia can be a crucial step in addressing potential cancers or other obstructive anomalies early on. Ignoring or dismissing difficulty swallowing can lead to more significant complications, such as malnutrition and dehydration, which further complicate senior health. Therefore, taking swift action to understand and treat this symptom can prevent escalation and open pathways to effective treatment options. Empowering oneself with knowledge and timely medical consultation is key. By acknowledging and addressing difficulty swallowing, seniors can better manage their overall health, ensuring they remain not only nourished but also vigilant against silent threats lurking beneath the surface. Number 7. Changes in bowel or bladder habits. Monitoring changes in bowel or bladder habits can reveal critical insights into one's health, particularly as these alterations might signal the early stages of cancer or other serious conditions. For seniors who may already experience a range of health issues, keeping track of these changes helps in catching potential threats early on. Alterations in bowel habits might include persistent diarrhea, prolonged constipation, or unexplained changes in stool color or consistency, such as black or tarry stools, which could indicate bleeding in the gastrointestinal tract. These symptoms might point to colorectal cancer or other gastrointestinal disorders that necessitate immediate medical evaluation. Similarly, changes in bladder habits, such as increased frequency or urgency of urination, pain during urination, or blood in the urine, should also raise red flags. While these symptoms can be related to urinary tract infections or benign prostate issues, they could also suggest bladder or prostate cancer, which are not uncommon in older adults. Given these potential health implications, seniors should seek medical advice if they notice any persistent changes in bowel or bladder habits. Healthcare providers may recommend diagnostic tests such as colonoscopies, endoscopies, or urinalysis, which can help determine the underlying cause of these symptoms. Tackling these issues promptly enhances the likelihood of addressing them effectively, minimizing complications and improving outcomes. Being aware and proactive about these changes empowers seniors to maintain control over their well-being. Regular checkups and open discussions with healthcare providers about any concerns facilitate early detection and treatment. Health vigilance, especially regarding elimination habits, acts as a vital tool in maintaining the delicate balance of the body's systems as we age. Understanding the significance of these changes allows seniors to take preventative measures, ensuring they remain healthy and active in their later years. Vigilance is the cornerstone of health, and by recognizing these signs, seniors can ensure that their golden years are spent in the best health possible. Number 8. Recognizing unusual bleeding or discharge. Something as subtle as unexpected bleeding or an unusual discharge can be the body's way of signaling that something is wrong. For seniors, these symptoms warrant particular attention, as they can be early indicators of several serious health issues, including various types of cancer. Unplanned or unexplained bleeding, whether it be in the stool, urine, or from any other body orifice, should never be ignored. Hematuria, or blood in the urine, can be a symptom of bladder or kidney cancer. Similarly, blood in the stool may suggest colorectal cancer, a major concern for older adults. Women should be particularly mindful of postmenopausal bleeding, which could be an early sign of endometrial or cervical cancer. Unusual discharge, such as that from the nipples or genital areas, can also be a warning. Nipple discharge, particularly if it is bloody, can indicate breast cancer. Abnormal vaginal discharge, especially if it is persistent and accompanies other symptoms, may point towards infections, hormonal imbalances, or cancers of the reproductive organs. Addressing these symptoms with a healthcare provider can lead to early detection, which is crucial for effective treatment. A detailed assessment, possibly including imaging tests, endoscopic evaluations, or biopsies, can determine the root causes of these symptoms. Prompt evaluation not only aids in ruling out or confirming cancer, but can also identify any other treatable conditions early on. For seniors, maintaining an open dialogue about such changes with healthcare providers is imperative. Awareness and timely action can vastly improve management and prognoses of potential health issues. By keeping a vigilant eye on the more discreet messages the body sends, seniors empower themselves to lead a healthier, more aware life, addressing potential issues before they become significant problems. Number 9. Unexplained lumps or swellings. The sudden appearance of a lump or swelling can be unsettling, especially for seniors who are more prone to doubts about new bodily changes. These growths, which may appear without accompanying pain, could be a manifestation of benign conditions or, more importantly, a sign of cancer. Lumps can appear nearly anywhere on the body in areas such as the neck, underarm, breast, or groin and are often indicative of growing tissue or inflammation. Notably, breast cancer can present as a stationary lump, one that's hard and immobile, often with irregular edges. Similarly, swellings in the lymph nodes can be linked to lymphoma or metastatic cancers. Even if a lump is painless, it's crucial not to dismiss it outright. Consistent monitoring and evaluation are necessary to ascertain whether the growth changes in size, texture, or sensitivity over time. Further investigation by a healthcare provider usually involves physical examination, imaging tests like an ultrasound or MRI, and potentially a biopsy to determine the makeup of the lump. For seniors, particularly those with a family history of cancer, remaining vigilant about new and unexplained growths can lead to early detection and treatment. The habit of conducting regular self-examinations, particularly for breast and testicular lumps, is incredibly beneficial. If a lump isn't going away after a few weeks or is showing increased growth, it necessitates a medical consultation. Taking immediate action upon detecting an unexplained lump equips seniors to tackle potential health threats head-on, ensuring that, should there be an underlying malignancy, it can be addressed swiftly and effectively. This proactive approach enables maintaining one's health and quality of life, reinforcing peace of mind in knowing that potential health issues are managed vigilantly and effectively. Number 10. Breathing challenges and their meaning. Breathing is a fundamental process, often going unnoticed until it becomes challenging. For seniors, struggling with breathlessness or respiratory difficulties can paint a picture of underlying health challenges that may be more serious than initially expected, including the possibility of cancer. Challenges such as shortness of breath, wheezing, or persistent chest discomfort may seem attributable to age or chronic respiratory conditions like asthma or COPD. However, these symptoms might also indicate lung cancer or related respiratory tract cancers, which often present subtly at first. Intermittent breathlessness that escalates over a short period, especially if accompanied by chest pain or unexplained weight loss, can be particularly concerning. In cases where breathing difficulties emerge suddenly or intensify gradually, seeking medical attention is paramount. Healthcare providers can conduct thorough assessments, including pulmonary function tests and imaging techniques, such as chest X-rays or CT scans, to determine the cause of these breathing issues. Pinpointing whether such symptoms stem from cancer or another cause is key to effective management and treatment. Awareness of how breathing challenges manifest can empower seniors to react promptly. Not dismissing these signs can help catch conditions early, leading to better treatment outcomes. Regular checkups and open communication with healthcare providers about respiratory health are essential. Intervening when respiratory issues first appear not only helps in diagnosing potential cancers but also prevents complications from other conditions that might otherwise have been overlooked. Striking a balance between attentiveness and action ensures seniors remain actively engaged with their health. By recognizing and responding to breathing challenges, they can better manage their overall health, ultimately paving the way for a fuller, more comfortable life. Vigilance regarding such symptoms allows seniors to take control of their respiratory health, maintaining the quality of life that is so deeply cherished. As we close this comprehensive guide to recognizing cancer warning signs among seniors, it's crucial to emphasize the value of vigilance and proactive healthcare. For continued guidance and support, consider subscribing to our channel or service, where you can find more insights and resources dedicated to senior health and well-being. Stay informed, stay healthy, and take charge of the years ahead with confidence and peace of mind.